Welcome to Chameleon. In this brief demonstration, I'll let you taste some of the main features of this extensive clinical health record. First, let me log into Chameleon as a physician in the emergency department. The first screen we see after login is the emergency department's dashboard. You can see that we currently have 5 fake patients in different statuses. In addition to demographic information, such as the patient's ID, name and age, we can also see some useful administrative information, such as the patient's allocated bed and color-coded patient status. You can see that one patient is ready for physician, while another is waiting for tests. On the right side, we can see the different stations the patients have undergone during their visits: triage, nurse assessment, physician assessment, etc., as well as the staff in charge of their treatment. The dashboard also shows us the essence of the patient's clinical information: referral reason, urgency level, last vital signs, and the existence of orders or test results. Now let's enter one of our patient's charts. The patient's chart is composed of a header and 2 main areas. The header gives us general information about the patient and the current visit. The left pane shows a summary of the important patient's information, as well as access to previous visits and external documents. The right pane is the main working area in the patient's chart. It is divided into different tabs for the convenience of the different clinical role players. Each tab includes multiple information components, which are fully customizable to meet the changing needs of different hospital units. In this short demonstration, I'm not going to show you all the variety of components already available in Chameleon, but rather demonstrate how physicians can write medication orders. I'm going to show you 2 simple ways to do so. The first and straightforward way is to write your own order. By clicking the Medications Order link, we enter the Medication Order window. In the header of this window, beneath the patient's details, we can see that she is allergic to ibuprofen. This alert will accompany us to avoid serious mistakes. Clicking the type of the desired medication will open a drug selection window. On the right side of this window, we can see the patient's details, as well as their documented sensitivity, current orders, last vital sign measurements, and diagnosis. Within the drug list, we can see both generic and trade names, and all the medications that contain ibuprofen are clearly marked, so the physician can avoid ordering them. In our case, I would like to order a tablet of Crestor for the patient's hypercholesterolemia once a day. I'll choose Crestor and get the default dosage and administration route already filled. I may choose to order the medication as a continuous infusion, as periodical administration, once or per patient request. In this case, I want it to be given periodically, once a day. I can select start and end times or duration of treatment, and add specific instructions for the nurses. I'll click OK and enter my password, and I'm done. Since many of the physician orders tend to repeat themselves in given clinical settings, an easier way to write orders may be using predefined order sets aimed for different clinical settings. We have prepared multiple such sets. In this example, I'm going to choose an abdominal pain protocol. Clicking this green button will open an order window with a predefined set of orders. Please notice that an order set may include both medication orders and non-medication ones. This combination is very useful, such as in the case of antibiotics along with temperature measurements and blood tests, or painkillers with pain assessment. As a physician, I can modify the predefined orders or unselect some of them. Again, I'll enter my password and click OK, and I'm done.